Hello. Hi, welcome to my channel. This is Dr. Erica, pharmacist, coming to you for part two of the parasitic infective um, video. I am going to be talking more specifically about the medications and how they are used to treat and fight off these parasites, and they are going to be antiparasitic medications for pinworm, for hookworm, roundworm, or scariasis, and then also the lice as well, and scabies. So I will go over some medications that are, again, over the counter and prescription pharmacy for treatment. So stay tuned to the end of the video, and please like, share, and subscribe, and also save this particular video just in case you might need to review it at a later date. So I am excited about this video, and I'm going to go ahead and get started. Okay, so in part one, I talked about more specifically how to treat the head lice, the scabies, all of those external parasites, how to treat them, how to treat the home, how to actually eradicate them, and diagnosis as well. I talked about that. And I talked a little bit about the medications and how to use them, the kits, and how they are available, things like that. So more specifically for this part two, I'm going to talk about more about medication, pharmaceutical aspects of the drugs. So this video may be more for students. It could be also for those who need a tutorial on what to think about or how to exactly take the medication that's going to be prescribed. So stay tuned. I am talking about, first of all, mebendazole. Mebendazole is a medication that is specific for eradicating the pinworm, the hookworm, and the ascariasis or roundworm. And it is available through prescription, and the brand name is VERMOX 500 milligram chewable tablet. It is a chewable tablet, and it's a one-dose tablet. Also, there's a mberm is 100 milligram chewable tablet as well. The doctor may give one of the two. There's a 500 milligram that can be taken as a single dose, and for roundworm infection. Now, the mechanism of action is that it's going to block the formation of the helminths, microtubules, in susceptible adult intestine dwelling parasites only. Okay, and it's metabolized in the liver, and it's excreted in renal organs. Again, it's going to be metabolized in the liver and then excreted through the urine, and that is the VERMOX. So the directions are usually going to be um, um, based upon whether the patient is successful or not. Usually it's just one dose, and then continue afterwards for a repeat session if more eradication is needed. Also be aware that it's recommended to keep the container very stored very tightly, and also discard any unused tablets 1 month or 30 days post opening of the original container. So do be aware of that. Storage is very important because these are chewable tablets, and they are very specific. Now, mebendazole is a chewable tablet, and also it is first choice for treating roundworm, and also for treating the hookworm and pinworm. Now, it's recommended for ages two and above, and also for adults. Side effects: maybe neutropenia or agranulocytosis, and it's contraindicated in patients who have an allergy or who are hypersensitive to the medication. So do be aware of that. Again, those who are hypersensitive or have an allergy effect to the medication should not take the medication at all. And then those patients may experience neutropenia or agranulocytosis because of this particular medication. More commonly, patients have dealt with nausea, vomiting, diarrhea, GI upset, headache, things like not only headache, but seizures, drowsiness, dizziness, fever, just to name a few. And then also there might be a low count in the hemoglobin, and also again, neutropenia may be prevalent. Those patients who may be taking phenytoin for seizure medication, for seizure reasons, and also those patients who might be taking flagyl or metronidazole should not take this particular medication along with the mebendazole with those two medications. There is a contraindication, meaning that these medications or a drug interaction, I should say, these drug interactions are serious but not life-threatening. So do be aware of that. So, however, metronidazole or flagyl and phenytoin should not be used together with mebendazole just because there is a serious drug interaction that can occur. And toxicity in the body can occur when these two medications are taken within close proximity or taken together. So maybe one therapy should be discontinued, whereas another therapy may be decreased or increased, or however the need may be during the time of prescribing mebendazole with phenytoin and or flagyl. So do be on the lookout for those drug interactions. Now, again, the mechanism of action for mebendazole is going to be that this medication interacts or blocks the formation of the microtubules that are important. And microtubules are these proteins that help with the building of cells and also with the structure of the cells. So during replication and multiplication of the actual parasite. So once that is broken down and no longer able to occur, then the parasite will begin to be eradicated. Okay, so do understand that. And the dosing is different for treatment. So someone who's maybe taking mebendazole or VERMOX for pinworm may receive a different dose for someone who's taking it for ascariasis or ascariasis, which is going to be a little bit different. So do be aware of that. Also, now that we've talked about mebendazole, I want to move on to the next medication, which is going to be ivermectin. Ivermectin is for scabies and scabies in those who are immunocompromised, such as patients who may be dealing with the HIV virus, or patients who may be dealing with other viral infections. So scabies plus immunocompromising patients are indicated to take the ivermectin 3 milligram by mouth for one dose, then repeat in 2 weeks. This tablet should be taken on an empty stomach, no meals, and the weight determines the actual dosing. And so the weight of the patient actually determines the dosing. So the dosing is based on the kilogram weight. Okay, now a stool sample may be taken periodically to make sure that the actual worm or parasite has been eradicated. So do be aware of that. Ivermectin medication or diagnosis will require usually a stool sample to make sure that elimination is actually has occurred. And it's contraindicated in those patients who have a hypersensitivity or allergy to the medication. Now, ivermectin is a medication that will paralyze the actual parasite and muscle cells to get rid of the parasite, and it comes in creams and also in this 3 milligram tablet, but mostly it's available or manufactured as a cream, 1% cream and a 0.5% lotion. Okay. There are post-marketing trials and reports of neurotoxicity, confusion, disorientation, death, and drowsiness, and even coma. Okay, so be aware of ivermectin's post-marketing reports and also its general profile. Okay, and the brand name, I'll mention the brand name is called STROMECTOL. STROMECTOL is the brand name for ivermectin. Okay, now that we've gone over mebendazole, we've gone over ivermectin for scabies, and again, mebendazole is first choice for pinworm, hookworm, and roundworm. And then we have uh, we have ivermectin, which is first choice for scabies and immunocompromised patients. It can be used off-label for pinworm, for other parasitic infections, off-label only, but it is actually indicated for scabies with immunocompromised patients. That is its only actual indication. Okay, so that's easy to remember, and it only comes in 3 milligram tablet or lotion or cream. Okay, now that we've gone over that, I'm going to move on to uh, the pinworm or pinrid or pinx. This medication these medications are the brand name for pyrantel pamoate. Pyrantel pamoate is the generic for this one, and it comes 50 milligram per ml suspension, pinworm solution or liquid, and it's indicated for, again, pinworms and the roundworm. Okay, it can be picked up over the counter as a 1% solution. It's contraindicated with those who have hypersensitivity and those who have a liver disease. Also, it's contraindicated in those who have intestinal obstruction. Okay, so that's hypersensitivity, liver disease, and intestinal obstruction. Do not use pyrantel pamoate or pinworm. Okay, it's called rhesus pinworm over the counter. I've been able to pinpoint it out for patients who come in to look for it, and it is available. It can cause malnutrition and anemia, and it comes in 180 milligram capsule or 250 milligram per ml suspension. And the dosing is weight-based, the liquid form, and the mechanism of action for pinworm is that it blocks the cholinesterase protein, causing paralysis of the actual worm, okay, causing eradication. And this medication is very effective. It is available over the counter, and there's a stronger strength as well. I do recommend it, and that is mainly the medications that are used for scabies, pinworm, roundworm, and hookworm, and then also for the lice. The head lice kit is treated with permethrin 1%, permethrin 1%, and then there's also 5% permethrin as well. These medications are over the counter as NICs, over the counter, can be picked up. The kit has a actual threading comb to help rid the scalp of the actual lice, and it also has a lotion. There's shampoo as well that you can use, lather on with warm water, lukewarm water for about 10 minutes, lather it on, wash it through after the 10 minutes is over, and then you use the dry it, and then you use the actual the threading comb to help thread the hair through to remove any remaining eggs or remaining adult lice. And this treatment can be repeated within so many days or weeks. I think it's maybe 2 weeks in case that does occur. Also, it's recommended to get rid of all plush toys, all fabrics and bed linen and mattresses to make sure that the episode does not occur once more. I highly recommend boiling water to wash, and also using bleach products, also using Clorox, maybe ammonia products when washing with detergent, with that hot boiling water to be sure that these eggs and lice do not reoccur. So that is what I would recommend, and do do check with your healthcare provider for further information on diagnosis and going further with getting this taken care of. And I thank you for joining me for part 2. Please like, share, and subscribe. I'm Dr. Erica. Hit that subscribe button for me, and we'll be happy to. This is my platform, YouTube, and I'll be happy to go over any topics that you may have. And I hope this was very helpful. Thank you for joining me. I'm Dr. Erica signing off, and have a good day. Bye bye.